Good morning. My name is Kara Teeple, and I'm the CEO of Lawrence Hall. For more than 150 years, Lawrence Hall has been delivering high-quality, trauma-informed care for youth in Illinois. Annually, we serve over 1,400 youth and families. Today, I welcome you to our main campus, which is home to our therapeutic day school and our residential treatment program. I never thought I would ever be introducing the governor of our amazing state, let alone this amazing governor, so I'm humbled to say the least. Governor Pritzker has done so much incredible work for our state, and today we are talking about his investments in behavioral health. Behavioral health is so critical to our work, and I want to thank you, Governor, for the investments you have made. Thanks for coming to Lawrence Hall for such an important press conference and an important topic, and I'm going to turn it over to our amazing governor, Governor J.B. Pritzker.
Well, thank you so much, Kara, and good morning to everyone. It may be a little dark outside, but I have to say that as the temperature, generally speaking, is warming up, I hope everybody's spirits are rising. I am so grateful to be here and hosted by Lawrence Hall. For more than 150 years, this institution has been a pillar for supporting our families throughout Chicago, providing children and adolescents with resources and services based right here in their own neighborhoods. I'm really grateful for your partnership, so thank you again, Kara, and to all of your staff and everyone who cares about and supports this institution. As a governor, as a father, as a person who grew up in a household led by a single parent impacted by addiction, the needs of children and families who come to the state for help with behavioral and mental health struggles are particularly close to my heart. Maybe your child's developmental disability was evident from birth, and in addition to all the other challenges of new parenthood, you've spent years navigating programming to ensure that they live the beautiful, full life that they deserve. You may have learned from a local school counselor that your child needs more specialized support than the district can provide, like placement in a therapeutic day program or residential facility. Or maybe your child experienced a devastating mental health episode and had to be hospitalized, and now they need access to the right services to help them recover. There's no playbook on how to be a parent, but all of us spend every day trying to do right by our children. It's the greatest joy of our lives, and it's also sometimes completely terrifying. And in difficult circumstances like these, Illinois parents have far too often faced the additional obstacles of a system that is inefficient, confusing, and difficult to navigate. Here's what I believe. If a kid needs help, it should be as straightforward as possible to get it. That's as true for an in-school counselor as it is for everything from outpatient resources in the community to residential behavioral health services. And it's why I've increased funding for children's welfare and well-being each year that I've been governor, like our $86 million new investment to help schools improve mental health services, or our $78 million increase for therapeutic congregate care at DCFS. And this year, I've proposed we fund the complete redesign of DCFS's independent living program, which will better support youth transitioning out of DCFS's care. Members of the General Assembly are with us today, and I'm very grateful for their support in this effort and look forward to working together to build on the progress in this year's budget. Because, and make no mistake, these services aren't like a light switch that you can flip on and off. This kind of help can be destroyed in the blink of an eye, and if it is, it takes years to rebuild. The leaders in social services here with us today know firsthand the painful impact the budget crisis a few years ago had, and continues to have, on the families that they serve, even as they moved mountains to minimize the negative impact. I am truly incredibly grateful for their partnership. Throughout my tenure as governor, I've directed state agencies to collaborate and coordinate in all of their efforts, making state services more efficient and easier to access for Illinois' most vulnerable residents. The heads of all 6 state agencies involved in this initiative are here with us today, as they too understand the urgency of these issues. So today we're announcing the launch of the Children's Behavioral Health Transformation Initiative to evaluate and redesign these systems. As a result of this work, Illinois families will be better able to access holistic, wraparound support for children in need. And this initiative is in better hands. I'm proud to announce Dana Weiner, a nationally recognized child welfare expert based at the renowned Chapin Hall Research Center at the University of Chicago, is coming aboard as the initiative's director. Dana is here with us today and will speak to her vision in just a few moments. I've asked her to work alongside leaders in my administration to develop a transformation blueprint to better support Illinois' children in need, and to do so by the end of 2022. Our children are our greatest treasure, and not one of them should fall through the cracks because of an antiquated system that is too small and too slow to fit the scope of their needs. We can build something better for them, for their families, for all of you who call Illinois home. And that's the mission that we're advancing today. So thank you for joining us, everyone that's here and those who are listening in. And with that, I'd like to turn over the podium to a truly outstanding new director of the Illinois Children's Behavioral Health Transformation Initiative, Dana Weiner. Dana?
Thank you, Governor Pritzker, for entrusting me with this challenge on behalf of Illinois children and families. As you described, I'm a psychologist, a policy researcher, and a parent. I care deeply about children and families and about ensuring that they have access to the supports they need to be healthy and strong. But I also care deeply about using data and evidence to inform the policies that affect the lives of children and families, and about using data to understand and address inequities and disparities in access to services and resources. I have dedicated my career to helping system leaders use data to make better decisions about programs, resources, and services for children and families. I also want to thank Chapin Hall Executive Director Brian Samuels for supporting this opportunity to apply Chapin Hall's commitment to bridging research and practice. Chapin Hall works to generate rigorous, evidence-based solutions that can transform policy to achieve equity and promote well-being. Together, we will do better for the children and families of Illinois. Illinois has many of the programs and tools necessary to promote the behavioral health of children and the strength and stability of families. We have committed providers, some of whom are here today, strong communities, and caring parents. We have the capacity to deliver sophisticated, evidence-based interventions, and we have leaders, all of whom are here today, committed to a new vision for a coordinated system in which children don't fall through the cracks. What we need is an intentional, coordinated strategy to get families the help they need for kids who are struggling. Our current system is difficult to navigate and does not provide families with consistent, transparent solutions to the challenges they face. This uncertainty can threaten the healthy development of children and the integrity and stability of families. This is the challenge we face, and I am up for this challenge. Improving social service systems to make services available to all families that need them has been my life's work. I am honored to have the opportunity to help improve behavioral health services for the children of Illinois. We can do better for our children and families. We must do better. Thank you, Governor Pritzker, for this opportunity and for your commitment to improving the lives of all Illinoisans. And now we will hear from a champion for children and families, Senator Sarah Feigenholz.
Thank you, Dana. I'm not sure that there's anyone as excited to see you take this. I was told not to touch this. I'm following the rules on this side, okay? I'm so excited to see. I'm a rule breaker. Okay. I don't think that there's anybody as excited to see you or step into this role to help redesign and realign this really complex children's behavioral health system we have in Illinois. What you bring, the depth and the breadth of your experience to children and families, I don't think I've ever seen anyone whose brain quite works like yours. And so I think I know more than a lot of people here how right you are for this role. So confronting the challenges that we have in children's behavioral health is the most important investment we can make. In fact, it's the only one that will help us preserve families who are facing the most daunting task of caring for a child who presents and requires intensive services in order to put them on a path of therapeutic recovery. I have known J.B. Pritzker for a long time. No numbers. I'm not going to mention how long, but long before he became governor. J.B. Pritzker is the kind of guy who steps up. He always does what's right for children and families because he has followed in the steps of great people like Irving Harris, who began to focus on infant and early childhood mental health. And when Harris died, he picked up the mantle. Children are 1/3 of our population, but they are all of our future. Thank you, Governor. I know that this investment will make a lasting input on our children's lives, their parents, who we will hear from today. We'll hear from Michelle Traeger, because for her and families like her, we want to build strong families for the future. And now I'd like to introduce Senator Karina Villa.
Good morning. My name is Karina Villa, and I am the state senator of the 25th District. I am so honored to be here with all of you today. I am not speaking today as the senator. I am speaking today as the former school social worker who was in the trenches during that previous administration that Governor Pritzker was referring to. That was why I decided to run for office. It was because when the families were coming in to meet with me and talk to me and tell me about the concerns they were having with their students, I would then say, let's look for some resources for you. Let's look for some mental health resources for your family. During the last administration, those phone calls that I was making for services, I was hearing on the other end, we have a 3-month wait list. We have a 6-month wait list. We have a 1-year wait list. We don't even have a wait list because we don't have the capability to receive these calls right now. As a school social worker, I was desperate when I would look into the eyes of the families who needed this care. And I got to a point where I started questioning every day, where are the leaders and where is the voice for these students? And I know that we had leaders there fighting day in and day out, leaders like Senator Feigenholtz and others who were standing strong on behalf of the students. But that pressure when I was at the school meeting with these families was too strong, and I knew that it was going to be detrimental for many years to come if we didn't take action. So that was what encouraged me to actually run for office. So now, a few years after getting inaugurated, I stand here, and I stand here with all of you saying the hope is here. We are ready. We know what the issues are with mental health. We know that there needs to be changes, and the future depends on it. Our students' lives, our children's lives, our families' lives, our community lives, the lives of the communities of color that have been disproportionately impacted by so much in regards to COVID we know that the time is now, and I'm so proud and excited to stand here with the governor on this momentous day. It is my honor to introduce our next speaker, and that is Rich Bobby from, Rich, the Senior Chief Program Officer at Little City.
Thank you. My name is Rich Bobby, and I'm the Senior Chief Program Officer at Little City. It's an honor to be here. I'm also here as a parent as well, I'll add that. At Little City, for over 60 years, we've served children and adults who have autism, intellectual and developmental disabilities. We serve annually over 300 children impacted by the challenges that were just described earlier. Children, youth, and families are in crisis right now in Illinois, and the crisis is significant. We see it every day at where we work at Little City. Youth who have severe mental health, trauma, severe autism, severe intellectual and developmental disabilities are in absolute crisis, and they live the struggle day in and day out. This problem dates back more than a decade ago, and certainly has been perpetuated, and the pandemic certainly didn't make it better. If anything, made it incomprehensible to a point where families are just at their wits' end and could barely get through the day, to the point where we have some families we spoke with who are lucky to get 3 hours of sleep at night because of the challenges that they're facing by their loved ones impacted by either autism or severe mental health. Currently in the state of Illinois, there are no psychiatric or behavioral health hospitals that have the capacity to serve youth who have severe autism and intellectual and developmental disabilities. Sadly, what ends up happening for those youth is they go to a hospital emergency room. They will spend many days, countless days in the emergency room, to the point where that's where they live until they can go back to their family or to a residential setting. I'll just share a quick story of one of those youth who is now transitioned to our residential program and goes to our therapeutic day school. His name is Alex. His mom gave me permission to use his name. Alex is a 16-year-old boy who has severe autism. He's limited verbally, and Alex was living in a hospital ER for over 100 days. He wasn't able to leave. He was in a single, I'll call cell, essentially because of the safety risks that he posed to the general community. He was there because Illinois did not have the capacity to serve him, didn't have the resources to serve him. Over 100 days, over 2,400 hours of living in an ER. 1 hour in an ER, I think we can all agree, is too long, but over 2,400 hours living in an ER because we did not have the resources in the state to be able to serve him. And fortunately, we were at a place where we were able to, and he's living with us now and going to our school and doing very well. Still has some struggles, but for the most part is benefiting from the services that we provide. And that's just one story. Right now, youth in Illinois who have severe mental health, youth who have severe autism, are literally being transitioned out of the state to get services because, again, Illinois does not have the current capacity to serve as great of the need as there is today. There is a cliff when it comes to youth who have autism, severe autism, where they literally drop off of once they enter the adult services because they don't have the skills or capacity to be successful in adulthood because of, again, the lack of services that are in existence today. We at Little City look forward to being part of the solution and developing groundbreaking solutions to help address and be a part of that. And we thank the governor and his administration for taking this issue straight on, and the challenge that we face to be able to expand our own capacity is workforce. Workforce. The shortage of staff, the shortage of people being able to have the mind, heart to do this work is limited. And for the first time with our current governor, he and his administration have invested in tackling the workforce challenges that we're all facing. And so we thank Governor Pritzker dearly for his investment in really developing a workforce so we can serve those most vulnerable youth and families. Governor Pritzker and his administration have addressed this challenge head on, and we are just delighted and applaud Governor Pritzker for appointing Dr. Weiner. She is an amazing person, has a track record of success, is collaborative, and we are confident with her leadership and working closely with her that we will achieve better outcomes for youth and families who are in need. Thank you, Governor, and I'll pass it now to Senator Simmons.
Good morning, everyone. Can you hear me? My name is Mike Simons, pronouns he, his. I am the state senator for the 7th District, which is where we are right now. Lincoln Square, Uptown, Edgewater, Rogers Park, and Westridge. And I just want to say before anything that in the year that I've been a state senator, I have really enjoyed working with Kara Teeple of Lawrence Hall. This is an amazing agency. It stood out for me from day one as a key agency in this part of town that is doing great work for our young people, and so I really thank you for your leadership and your commitment to our youth. I just wanted to say that I'm also really appreciative that Governor Pritzker clearly has a personal interest in looking after our young people and their mental health. That really means a lot to me, and I'm just excited that I get to partner with you in doing this work for youth all across this district and the rest of the state of Illinois. I wanted to mention really quickly that in the year that I've been in office, we have gone out and we have actually sat down with children in this district and teenagers, and we've convened people's legislative councils where we're essentially co-governing with people from all across the district, and I love that a part of that comes directly from youth. And the number one issue that our young people are telling us in the 7th District, where you are right now, is that mental health is a big systemic issue for them. Getting access to mental health, feeling like mental health is still stigmatized, oftentimes not having language for conditions that our young people are facing, and just really needing for us to shore up the services and access points. And so this is such an important part of that. The announcement that the governor is making today is a key response to that need that we've heard so clearly and crisply from youth from all across this district. And so I'm personally excited about that. And really I'm looking forward to partnering with this interagency working group to have a more coordinated response to mental health needs all across the state of Illinois for our children. They deserve it. They've been through so much during this pandemic, and we really need them to carry on. And I haven't met Ms. Weiner, but I'm looking forward to working with you as well. To make sure that we have really strong data and research so that we can continue to expand on the services that we know work. And of course, our young people are innovative and they give us all kind of great ideas. I always say that we learn from young people. They teach the world. And so I'm looking forward to seeing what our young people and children have to say in this discussion as well. So thank you so much. What a wonderful day for our children in the state. And I would like to now give it over to Michelle Traeger. Thank you.
Thank you, Senator Simmons. I'm a mom of 4 children. Our oldest is 16 years old and now living in a residential facility in another state. Our story is both intensely personal and tragically common. We adopted our son when he was 14 months old. As he got older, he increasingly struggled with emotional and behavioral dysregulation that significantly impacted everyday life. For more than a decade, we sought interventions and recommendations from all sorts of professionals. There came a point when the behaviors were not just disruptive, but also dangerous. To peers at the junior high, to staff at the therapeutic day school, to siblings and parents at home, and of course to himself. Around that time, a comprehensive evaluation revealed a likelihood of prenatal alcohol exposure, on a background of early childhood trauma, both of which are significantly overrepresented in the population of foster and adopted children. Our son was already involved in the juvenile justice system by then. We were advised to seek residential treatment by applying to the mental health funding stream of the state. It's an onerous process for families. Although we were approved, none of their limited number of facilities would or could accept him. Our school district agreed that residential treatment was required for his education, but they could not locate an appropriate placement. All this time, our son, age 13, then 14, remained in county detention for 331 days. During this time, he continually self-harmed, necessitating many visits to the ER. Out of 10 times, only once was the hospital able to secure admission to an inpatient psychiatric unit, which sent him back to detention after 2 weeks of ineffective treatment. The self-harm continued. Because no residential treatment could be found, our son was then moved to the Department of Juvenile Justice. Thankfully, they realized that he needed treatment, not incarceration, and after a few more months, they were able to find a placement. However, by law, IDJJ's oversight of a youth is time limited. Thus, even though everyone on the treatment team agreed that our son required continued residential treatment and was not safe to return home, that facility said they had to discharge him. Our school district, Oswego 308, doggedly worked to find a placement, looking for more assistance from ISBE. There were no ISBE-approved facilities available. Thus, it was up to us. Eventually, we found a residential placement out of state, and we had to go through due process in the courts to send him there. This is an overwhelming financial cost for families and thus often prohibitive for families. As I said, our story is quite personal. It isn't easy to speak about, and I honestly would prefer not to, but policymakers need to know what families are living with. Many other Illinois families have experienced the same struggle. I have a master's degree in social work. I worked in and with these various youth systems, yet this still happened to our family. Many Illinois families are still in the throes of this crisis. Some are so desperate that they risk being charged with a lockout or losing parental rights to get the state to step in and help. They cannot wait for policymakers to hesitate or vacillate in repairing the flawed and broken process. I am here to tell you that my family and many others are eager to be part of this work. It's very exciting to see all of the stakeholders that are present here today. I can assure you there are no greater stakeholders than parents. They want to be included in this work. We very much welcome the commitment to improve the system for my son and all the other children like him. And I would like to thank Senator Feigenholtz and Senator Villa and Senator Simmons and my own state senator, Meg Loughran-Capel, who was a special educator and who has really taken this issue to heart. Because now there's an energy behind this. We can finally feel there's some motion on this, and I'm so grateful for that. So thank you for inviting me to speak here today. I hope I'm representing all the parents well, and we'd like to bring Governor Pritzker back up to answer any questions.
Is this yours by any chance? Okay. Thank you very much, Michelle. And you can see that even someone with a social work background who has put herself forward as a parent, a foster parent, and someone who cares deeply about children who are suffering and in need, struggles with the system that we have, which is why we are working so diligently to try to overcome the challenges in the system. So with that, I'm happy to take questions from members of the media.
Okay, so our foster son, Lawrence Hall,
Well, that's precisely what this is about, right? To make sure that we're coordinating systems and services so that people don't have to sit for 117 days or, as we heard, for sometimes longer and without getting the services they need. And parents, of course, are desperately in need, foster parents and others. And so, look, we've put tremendous resources in already to try to staff up, to make sure that we're serving these kids, to make sure that we're at DCFS, for example, hiring up to standards here, and then, very importantly, creating residential beds that got destroyed under the prior administration. 500 residential beds went away. And I think everybody here that's been involved in the system of providing these services knows that these don't come back like with the snap of a finger. It takes literally years to go build back up those, and that's why we all are committed to the consistency of investing in these systems. The challenge, as you may know, is that because of my job, I'm literally working sometimes 18 hours a day, sometimes even longer. And so, we obviously care deeply about trying to uplift the children that are in need of foster care and attracting foster parents that might have the time, the willingness, and the capability to manage and handle and love these kids.
Governor, can you address the latest top of the board lawsuit? It's mainly directed at the city's vaccine mandate, but it also names you in this lawsuit challenging that authority. Can you address that at all?
You're talking about the lawsuit related to teachers? Which one of the?
Another lawsuit yesterday challenging the city of Chicago's vaccine mandate, but because their health department gets the authority from IDPH, you were also named in this, challenging all that.
Look, there's so little that I can say about these lawsuits that have been filed, the vast majority of which have failed, the ones where judges have ruled temporarily in favor of the plaintiff go to appellate court, get overturned. So, I don't believe that any of this will be upheld. That is, that these lawsuits will stand. And look, there are people that have wanted to tear down the system of mitigations that we put in place since the very beginning. They're continuing to do it today. They were wrong then, and they're wrong now.
Do you support the mayor's vaccine mandate for city employees?
I think any city that wants to put in more stringent mitigations than what the state has required, the state has not required that. But cities where people, where the leaders feel like that's the right thing to do for the people of their city, they have the ability to put in those regulations.
If we lose 2,000 plus Chicago police officers, this is the worst possible time. If some are coming up, record high homicide rates, carjackings, armed robberies. I mean, this is a public safety issue, don't you think?
Yes, it is, and I think every officer who hasn't been vaccinated should go get vaccinated.
I have one more question.
Sure.
In Illinois, we have the second highest state gas tax in the nation after, our gas tax is doubled. Are you considering, because of the historic inflation, that it's time to repeal that?
We are looking at ways that we can reduce the gas tax across the state of Illinois, because we recognize, even since I introduced my budget, that war has now broken out, and the result of that war is that oil prices have gone through the roof. We're at $100 or over $100 a barrel, and that's way above where it was even back in early February when I introduced the budget. So yeah, we're looking at other ways that we can reduce the gas tax. And also overall, as you know, I introduced the Illinois Family Relief Plan, which reduces taxes not only in grocery taxes but gas taxes as well as property taxes.
Governor, you endorsed Anna Valencia for Secretary of State.
Yes.
This week, she and her husband had an ethics complaint filed against him for failure to disclose his lobbying efforts and income. What concerns do you have about that, and should this disqualify them from the race?
Look, people make mistakes. I think she owned up to the fact that she had not reported something on her form, but this is a good person. She's done a good job as the city clerk. She's handled, major programs for the city of Chicago, and to me, that's evidence that she will be able to handle what is an enormously important office in the state of Illinois, and that's the Secretary of State's office. She is a young, dynamic leader who will do well by the citizens of our state.
Conviction stands.
Thank you.